So now for bone conduction testing, you're going to open up NOAA software, find the patient's name, and then once you're in the test screen, which is what comes up here, the thing that you're going to have to change is your transducer right here, where you've got inserts, phone, high frequency headphones, bone, or speaker. So you're going to click right there to change it to bone conduction. And then you can pick the right or left ear. Everyone in here has normal hearing, so we're just going to do one ear bone conduction. Because bone conduction testing, remember, it's not ear specific. Intraoral attenuation is 0, so the better ear is always responding. The only time you would, and pretty much with normal hearing, you just mark those results and that's all we need. The only time you need to mask is if you see that ear bone gap. Then you have to put masking on the non-test ear to really localize that sound to the test ear to determine if it's which ear actually has the conductive component. All right, so let me show you in the booth. If you'll come in here, Melissa, and I'll place the bone oscillator. So have a seat here. This is the bone conduction oscillator. This portion right here, you'll see this raised portion. This is the part that has to touch the mastoid. So feel that prominent bone behind your ear. That's your mastoid. So on your patient, you're going to aim the sorry I shocked you, right to the mastoid, and then you place, it fits tight. Kids hate this thing because it's just annoying. But notice the other side, it's not on the ear, it's like right on the, and you might have to move it depending on the shape of the head of the patient. You need to remove hats, glasses, and you have to make sure that this portion is not touching the pinna. You don't want to give any signals here, so make sure that you've got a space between the bone oscillator and the ear. And then you start testing. Raise your hand when you hear the beep. You just tell them that like you did before.